We are very excited to present NAMI Tennessee Facebook at Home Live. We're going to do a 2021 year in review for mental health. But before we get to our guests and before we get to our topic, you know what I'm going to say if you're a longtime viewer. Sign up for NAMI Tennessee's email list. Just go to namitn.org. It's a free list, curated mental health content, lets you know everything that's going on at NAMI Tennessee. And it really hits hard on advocacy points, things that you can do to make life better for people living with mental illness and, of course, all of our friends and family. And listen, it's free. What better deal than that? So just head over to namitn.org and sign up for that email list right now. It's like an early holiday present for yourself. All right, enough of that. Let's go ahead and bring on our two awesome guests, Jeff and Roger. Hello, Jeff.
Hey,
You drew the short straw, so you get to introduce yourself first.
I'm Jeff Fladen. I'm the executive director of NAMI Tennessee, and a former Columbusite like Gabe Howard, but now many years in Tennessee.
Jeff, welcome. Roger, introduce yourself.
Hey, Gabe. I'm Roger Stewart. I'm the deputy director of NAMI Tennessee, and I've lived in Nashville for so long it feels like home now. So happy to be a part of this.
Now, wait a minute. So Jeff said that he was originally from Columbus and ended up in Nashville, and you just said that you've been in Nashville so long it feels like home. Where are you transplanted from?
Originally from North Alabama, but lived here now for about 34 years. No,
I feel
35 years. Yeah.
I feel like 35 years makes you from Nashville.
People who were born here do not believe that, but it does give me a nice history. So there you go.
Wonderful.
I could say my kids are native Nashvillians. So
there you go. That is perfect. All right, for the mental health year.
I have a test for Roger.
You have
know where the best meet and 3 is?
Well, it all depends on how far back you want to go. In Nashville, we give directions by what used to be there. So,
my dad might be from Nashville. That's my dad right there. You're gonna want to turn at Mr. Wickwicky's farm. There's no farmland, right? Yep. I said used to be. Who is Mr. Witwicky? He's yeah.
Well, nonsense. If you're my age, you remember Green Acres, and they used to do that all the time. But Gabe, I think you're probably too young for that.
Listen, Green Acres is the place to be. All right, let's jump into our topic. A lot of things happened in mental health in 2021, primarily because of COVID. Right? COVID seemed to put a lens on mental health. Now, when there's a big, bright, shining spotlight on mental health, a lot of people feel that mental illness ends up more in the shadows, severe and persistent mental illness. So that is my first question to whomever wants to jump in there first. With the added attention to mental health, does anybody feel like severe and persistent mental illness, schizophrenia, bipolar disorder, psychosis has sort of taken a back seat? Is it good? Is it bad? What are your thoughts?
Roger, you go ahead with that. Start us off, please.
Oh, okay. So I'm a Libra. There's two sides to every coin. There are good things and bad things about it. I agree. I love the added attention and the focus on mental health. Mental health is all about prevention. And that is something that NAMI has been about for a long, long time, is doing everything that we can to prevent the challenges of mental illness. And the way you prevent the challenges of mental illness is to focus on mental health. However, you're also right in that, we've shifted a little bit of focus away from the challenges of long-term, the serious persistent mental illnesses of schizophrenia and bipolar disorder and major depression. And it means that there's so much so many people turning to the system all at once have really kind of overburdened the system. The other thing that we have seen that is both good and bad is the enormous number of people who have turned to substance abuse treatment during, COVID times. And the bad news about that is the enormous number of people who are lacking in other coping skills and have needed substance abuse treatment.
Thank you so much, Roger. Jeff?
It's really an interesting dichotomy here, because we hear so much about depression and anxiety, and that's really great and important, because those things can really impair and impact people's lives. But when you look at a lot of the new money that's come along, it is for more serious mental illness. When you talk about mental health emergencies, crisis, there's been a lot of dollars really into kind of beefing that up and expanding crisis services. So that's a good thing. But I do worry that when we talk about mental health for everybody and we focus on people with more anxiety, more depression, what about people living with schizophrenia, for example, that are homeless? I just had the great opportunity to have a sabbatical. I had some time off to refresh, and it's kind of a NAMI thing that we talk about self-care a lot and taking care of ourselves. So I had a chance to step away, and I was fortunate to travel. And I was in Oregon, on the coast of Oregon, and I saw quite a few homeless people out in beautiful remote places. And I'm thinking, who is caring for people like that right now? And are we doing a disservice when we are spending more money on mental health, and this is really important, and we're not maybe taking care of people that end up in jail and homeless and those things? And so I'm really proud of NAMI that we have a great focus on that, as well as education and prevention.
I think one of the things that really kind of scares me a little bit is the long-term impact on children, and how long we can keep the focus on mental health and keep the focus on keep some of the mental health dollars that are coming into the system right now, because we're going to need it for a really long time. I think one of the issues that we've seen unexplainably a dramatic increase in the number of children who having anxiety disorders and tic disorders and other things that triggered during COVID, that we don't know exactly how those would have triggered if all the COVID challenges weren't there. We're going to be dealing with the long-term impact of this for many, many years.
I think that's right, because children are sponges as well. And so if the parents are anxious, the children are anxious. And then early in COVID, I was sad when I would go out in a park and I would see the playground with stay out signs all around it, and kids not able to play. But then the anxiety of back to school and can they play? Now they can get vaccines, but children need the social contact, and adults need social contact too. So we've got a whole lot ahead coming here with the impact of this on the well-being of our country. So I do hope that normalizing mental health as part of health, instead of being a total separate thing, is here to stay. Like Roger used to mention to me about, we have different insurance for the brain than the rest of the body, and that's been kind of true. And I think we're beginning to integrate more.
Yeah.
I am always fascinated how mental health and physical health are separated out, considering your mental health, it is part of your body. I don't know of anybody who's experiencing a mental health challenge or issue. And one of the examples that I always use is grief, right? Nobody feels their best after the death of a loved one. And they understand that. They understand that while there may be nothing physically wrong, and I'm making air quotes, because of their grief, because of their loss, you just don't feel well. Nobody thinks they feel great when someone they love has passed away. It's like that, of course, for all mental health challenges, whether it be the far end of the spectrum, schizophrenia, psychosis, bipolar disorder, or the other end of the spectrum, anxiety, depression. All of these things fit on a spectrum, and they fit on a place. But make no mistake, if you're suffering from anything, regardless of where you are on the spectrum, it's going to impact how you feel. And how you feel is what people associate with physical. So I am excited that more people are paying attention to this concept that mental health and physical health live in the same body, and how we feel is important. Now, the media has focused almost entirely on mental health, and the government seems to have focused in large parts on that as well. Now, Jeff, you are in probably the best position to explain this and correct it, but there's been a lot more money and resources freed up from grants, government grants, etc., to help address the mental health crisis in America right now, largely brought on by COVID. Is that money going largely towards mental health challenges and issues and things that are brought on by the pandemic? Is it pulling resources away? Is it just new money and the same money as over there? Jeff, this is where you shine.
Well, I'm actually going to take a little detour first.
Please.
And say that we're getting some new knowledge here about the brain and the body, and that everything in our cognition, mental health, all that is not just from the neck up. So you're hearing more about a thing called gut health and the nervous system through the body. And there's things that happen with I guess, neurochemistry, if that's the right term, and synapses and all that. All the action is not in the brain, but throughout the body and the nervous system and the gut. So you're going to hear more about gut health, I think. So maybe you hear it here first. Although my daughter was talking about gut health, and she just studied to be a physician assistant a couple years ago. So the brain and the body, it's not a dichotomy anymore. And what happens in the body floods. Let's talk about anxiety. Flooding of something in your body feels different, and you feel in your stomach maybe, or in your gut and all that. So there's a lot going on, and maybe some things that can help us as well, as far as food and sleep and things like that. You know, we're learning more, and I hope that this is in its infancy and this will continue. But to go back to the money thing, the system has had a massive amount of money pumped into it. And one example in Tennessee is we now are expanding school mental health liaisons that aren't doing treatment, but they're a liaison, I guess that's the right word, between the school and mental health, and they help normalize mental health. And I think that will stay. So I don't think that the money is being diverted to mental health, that it's more new money coming in. And I do have a concern later. What's going to happen when the one-time COVID money is not around? That will be a challenge. So that's why it's important that we collect data and we find out, are we saving things down the road by investing and helping people to manage anxiety and depression and get help earlier? And maybe we find that it saves money.
Yeah,
So
Jeff, I agree with you. But I want to push back a little bit against something that Gabe said, and I'm not sure that the government is putting focusing more on mental health than other things. You know, we look at what the government has done during COVID times, and they've offered rental assistance and they've offered food assistance, but we already have systems in place to take care of those things. And the real challenge that we've got is all of a sudden we discovered, hey, we got to beef up the mental health system because we don't have all the delivery mechanisms and we don't have all the same professionals in place. Now we're kind of seeing some system-wide issues because if we don't have, you know, enough truckers to be able to move food, then we've got disruptions in the system. If we don't have enough pharmacists in the drugstores to be able to fill prescriptions, we've got disruptions in the system. And those are the kinds of disruptions that we've experienced in the mental health system for quite some time. And we're, now trying to beef those systems up and focusing on how we get more service providers in the pipeline and how we retain those service providers and get them the experience they need to be really good at their jobs. Because like we've been talking about, these needs are going to go on for a while. Hopefully we can sustain it.
Yeah, one thing I see that's missing, Gabe, is when we talk about caregivers. So I'm going to step back and say that there's more focus on low-tech things like getting sleep, exercise, eating well, and that can make us more resilient. But the low-tech issue of support for caregivers does not get much attention, and it's just really, really important. And when you talk about more disabling long-term mental illness that's really interfering more with life, the value of caregivers in making a difference is immense. But also there's an impact. Imagine if you have a child, they grow up, they don't want to go to school, they're staying up late, they don't seem to be able to hold a job, and it's challenging.
Yeah.
And whether there's an illness there or not an illness there, if people are having trouble controlling their behavior or making good choices, that's challenging. So I think we're missing the boat on caregiver focus, though, which we all become caregivers. But if it's something that's ongoing, then more support's needed.
I think NAMI's not missing the boat on that, simply because that's what we do. And we have seen dramatic increases. And I frequently used to, when I would do presentations, I would tell people I wish I was a bad parent. I have 2 adult children with mental health conditions, and if I was a bad parent, I could take a class and improve my parenting skills. I took 3 classes like that, and not one of the 3 told me anything about raising a child with bipolar disorder. That was not something that was a part of the discussion. And so when I was able to take a NAMI class, and they didn't phrase it as a parenting class, they phrased it as a information about caring for my child class. And we teach those same classes now in NAMI Basics. And we have already we're halfway through this year, and we've already had almost as many classes in the first half of this year as we did in all of last year. So there's a real increased demand as the symptomology. I know I can't tell you how many adults my age who are parents of adult children who suddenly find themselves with a boomerang kid as a result of COVID. People lost jobs, they lost housing, they've moved back into their homes, and parents are seeing symptomology in their adult kids that they weren't aware of when kids were off living on their own, and they weren't aware of all the challenges that their kids were facing. And they're really desperately seeking coping skills now, and seeking even more than coping skills at that initial stage. They're trying to understand, why didn't we see this before? Why didn't we know all this was going on? What can we do to help make it better?
Yeah, I would agree, and I would say that NAMI is increasing its focus and continuing to maintain that effort for caregivers. But I'm not really seeing that spread very much, and I hope that others would take up that banner also.
I think it's really important to consider that they're often referred to as wraparound services for the person living with mental illness. And I think those are so important. If you live with a severe and persistent mental illness, you need much more than access to medical care and access to medication, right? You need access to housing, you need access to transportation in many cases, you need access to fighting the system, et cetera. And I'm often surprised in that wraparound care that people don't see the value in the support system. And a lot of times by the time people reach the system, not in every case, but in many cases, you have a lot of burnout on all sides. Everybody is angry. And I'm speaking a little bit in my own experience. By the time the crisis hit, I didn't trust my parents as far as I could throw them. Partially because of the mental illness, partially because of all the mistakes that they made, partially because of all that we had been through. And it wasn't until I got to NAMI, my family found NAMI, that somebody explained, okay, this is what your son is going through. And suddenly my parents are like, okay, well, he's not a jerk face. He's sick, right? They gave them different tools. And then my education went another way, where this is what your parents went through. And I was like, they're not jerk faces. They're struck down by the same barriers that I was. And suddenly that put us from being at odds to being together. And now I have a wonderful support system. And not for nothing, it's nice not to just be angry at your family, right? That it's a burden to carry, to be mad at your loved ones.
But you hit in a barrier there, and that barrier is the challenge of nobody. I don't care if you're the person with a mental health condition or the family member. Nobody wants to feel like you have to have a support system. Nobody wants to say, "Hey, I need a support group," because it makes us feel weak. It makes us feel stupid, because why didn't I know this already? Why did no one tell me this before? If I say I don't know anything about this, then people are going to think I'm ignorant. There's just so many challenges with it. Feels like we're expressing weakness, and yet that's not at all what it is. And we do need support. And we utilize that kind of support in so many different ways in our lives. But for some reason, when it's mental health or any form of behavioral health, we're challenged with that. We're challenged with reaching out and saying, "Hey, I need some assistance with this," until you don't have any other choice.
It is utterly, it's fascinating to me. This is Gabe Howard's opinion. It's fascinating to me that we have expressions in our society well understood. No one's an island, right? Because we're all, bouncing off of each other, right? I am a male. I have a wife, and everybody's like, oh, well, behind every good man is a good woman. So there's this recognition that couples are supporting each other, and that allows, again, it's a very antiquated phrasing, but in the 50s, this meant something.
It takes a village.
It takes a village, right? And just on and on and on. But for some reason, much like in the case of peer support, for some reason, because it's mental health, it's bad. Peer support has existed for years. It's existed. Go to any real estate office and you will see peer support. All of the realtors supporting each other in different neighborhoods and different classes. That all the people who sell condos get together and exchange ideas. All the people who sell mansions exchange ideas. You go to sales conferences and the top salesperson is teaching all the salespeople below. But when you try to set up that exact same thing for mental health, suddenly I don't know. So you're right, Roger. We have to get over that thinking, because the reality is there's almost nothing that we can do alone. Can you imagine what a waste life would be if we had to teach ourselves every single skill? I mean, think about it. Just like go all the way back to the beginning. We have to teach ourselves how to tie our shoes. Nobody will help us, because that would be support. We have to learn how to tie our own shoes. It would just be such a cumbersome waste and time that you could spend learning science.
Gabe, you don't need to tie your own shoes. We got bootstraps for that.
We have bootstraps. No, I'm busy picking myself up from the bootstraps.
but we've still thinking in along those same terms, because we've got YouTube and you can go and get a video for everything. But okay, so
hang on. I don't mean to interrupt you, Roger, but you do recognize that watching that video means you're accepting support from a stranger.
Well,
literally from a stranger.
Here's the thing, though. Here's where I was headed to with that. You're right, but true confession. Okay, so I was fascinated by the concept of Tai Chi, and I really wanted to take lessons in Tai Chi. There were none available, so I thought, hey, I'll YouTube it. The difference is there's nobody there with the experience to be able to say, I see you trying really hard, but you're not quite getting it right. Your form isn't correct. You need to move this way and change this. And that's, the value of those peer-to-peer interactions ongoing, and that's why it really, we can learn things from each other like that, but there's we have to open ourselves to the intimacy of making a connection with other people in the process. Otherwise, we can guess at what we're doing, but we may not be getting the form right.
I completely agree. Well, I think we've definitely covered how much attention is being spent on it, and it's a wonderful conversation. But before we run out of time, I want to segue into a few other things. One of, in my opinion, the biggest story of 2021 that had to do with mental health was Simone Biles. I mean, it really had everything. She's probably one of the greatest gymnasts of all time. You had the Olympics. You had the Olympics being delayed a year, which put just extra focus on it. And all of a sudden she stands up and says, listen, I can't do this. I am not mentally healthy enough to do this, so I am going to sit out, which the internet exploded. Some people saying, hey, having that kind of awareness and realizing that you can't do these dangerous things that could literally paralyze you if you get them wrong because you're not in the right headspace is exactly what we want from people. We want people to stand up and say, I'm having a mental health challenge and I need help. On the other side, we had people saying, look, this is a once in a lifetime opportunity. You have the opportunity to not only win gold for yourself, but to represent your country, and you're sitting it out because you don't feel good, and everything in between. Now, I'm fairly certain we're a fun mental health group here, so I'm certain that I know your thoughts. But what are your thoughts for the viewers on Simone Biles? Good, bad, in between? And then also, don't hesitate to draw it out to what you think of the general conversation that Ms. Biles created in our country surrounding mental health and personal autonomy.
I think that it's tremendous that somebody on a stage that large had the courage to speak up and speak out in front of the cameras. And we also had a Tennessee Titan football player who I didn't prepare, and I can't remember his name right now, a wide receiver, who disclosed. And then we had Kevin Love, the basketball player, and these things normalize this issue that, hey, if I need to get some help, I mean, if I'm bleeding, I'm not going to go to work that day. And mental health days used to be a joke. I need a mental health day. And now we're talking seriously about taking mental health day from a day off work. So I think it's tremendous. And I'm glad she got some support and not just criticism.
I believe the Tennessee Titan was A.J. Brown.
That's right.
I Googled it. I can't even keep like a straight.
I'm glad you did. Thank you.
While Jeff was talking, I was just Googling. I try to be like, yeah, I know it. It's AJ Brown. Yeah, no, yeah. Google hooked me up. Roger, I apologize. Same question to you.
No, I was sitting here thinking as Jeff was talking, we would not question if an airline pilot got on a plane and said, this craft is not safe to fly. We need to not take off. Here's a professional doing evaluation to say, I'm not going to do this because it's not safe. And no one would question his judgment. And yet, Simone Biles, huge amounts of criticism, all the things that we've talked about. And she's a professional. She knows her skill. She knows her craft. And she said, no, this is not safe for me to do. No question. She's right. She should I'm glad she did it. I'm glad she was willing to take all the heat for that, so that somebody else next week can say the same thing and it be a little bit easier for them to do it.
One of there's so many things that can be said about Simone Biles, and many of them have been discussed ad nauseum. But one of the things that I think got missed a little bit in the conversation was, look at how difficult it was for her to stand up. Whenever there's a high profile uh, suicide or issue, I think of Robin Williams, and everybody's like, well, why didn't he tell anybody? Why didn't he stand up and say so? Why didn't he take a break? Well, he's a boom, 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 boom. All these reasons that he should have just stood up and said, look, I need help. And everybody says that after. Well, Simone Biles did it before. And look at the criticism that was instant, the stigma, the discrimination, the insults that were instant. Now, I recognize that we're all not elite Olympic athletes, but sincerely speaking on behalf of somebody that lives with mental health issues, I live with bipolar disorder. Whenever I stand up and say I can't do something, especially before the people around me really got educated and knew, they know better, so they do better now. But in the early days, when I'd say, look, I can't go, oh, Gabe, you know how you get, come on, they'd push me. And they didn't know any better. I want to be very clear, they didn't know any better. But people living with mental illness experience some small part of what Simone Biles went through when we do stand up and say that we're having a mental health challenge. Or we don't always have those words, of course, but when we're not at our best and we're asking for help, and people say things like, oh, you're just being dramatic, or things like that. So unfortunately for Simone Biles, like I believe you said, Roger, she kind of took the hit for the rest of us, right? We were able to say, this is why people don't speak up. Look what happens when you speak up. Look, I recognize that we all don't end up on Jimmy Fallon, or making our rounds in the national media, but in our own little circles, it feels like everybody is criticizing us because we asked for help. What are your thoughts on that? Again, not from Simone Biles level, but you both work at NAMI, and you talk to people like me and our families all the time. And there just seems to be lots of misunderstanding and accidental stigma and discrimination, or sometimes purposeful.
Well, I think there's a challenge here, and this is not going to exactly answer your question, but I was sitting here thinking about Simone and others, and the issue is about work. And I think that work in general promotes recovery and well-being. But I'll just share a personal story for myself. The first time I had what I would call a really just challenging depression, I tried to work, and then I reached a point and I said, I need to take some time off. And I took a week off and pretty much was alone and felt terrible and wasn't doing anything. And that really did not help. So the issue of okay, taking off work, a day or two and rest is one thing. But if it's quitting a job or taking extended time off and you're not in a program, and you're not actively working in recovery with a plan, I think that's a little challenging. And then also, people can be depressed. And Gabe, I think you probably could talk about this. You may feel like you're not doing good work, but other people are satisfied with your work. And if you plow through, you will feel a little bit better. You have good days and bad days. So I think that's a challenging one about work, and it could be other things too, like relationships and when to let go, and that, because when someone's depressed, part of you wants to maybe go in the bed and not do anything, which may not make people a lot better. I think the contact with peers, doing things, having a plan, having a program are really, really important. So I do want to get into that. I don't think that she just withdrew. I think she probably was working with people as well and actively, working on dealing with any symptoms that she had.
I think that's a very valuable point. One of the things that people said is that she abandoned her team. Yet, if you watch, she was standing there. It is true that she did not go out, and I don't even know what they're called. I'm not a. I know Simone Biles, and that's the end of my Olympic level gymnast knowledge. But she was there. She was dressed. She was talking to people. She was working. Now, we don't know what she did on the back end because honestly, it's none of our business, right? But she did seem to be present. Jeff, I agree with you. It is always difficult to know when to push and when not to push. This is the, again, self-disclosure. This is the constant struggle around my support system. I don't want to do anything. I hate my life. Okay, so should we let Gabe watch TV today and just, work it out himself and see what he does tomorrow? Or should we say, look, let's go to the grocery store. That's it. That's all you have to do, and I'll leave you alone the rest of the day. Knowing that if I can take a shower, get dressed, leave the house, accomplish a task, that little bit of success can lead to more success. And Jeff, you're absolutely right. The downside to mental illness, and there are many downsides, is sometimes we don't value our own work. We do something and everybody looks at it and they're like, that's beautiful, you did a really good job, but because of the lens of our depression or our anxiety or our issues, it looks bad to us, and we have trouble believing the people around us. So where does all that lie? Again, I go back to what Roger said. This is why a support system is extremely valuable, because if I'm left to my own devices, I suck, everything sucks, and there is no point. And that's not a good space to live in, especially unchallenged. Roger, I know you have a lot to say.
Well, we've got another challenge that we've got involved in this is that we have this miraculous expectation that self-care is free. And as we were talking about Simone Biles, I was thinking about a mom that I know who needed substance abuse treatment. She's a wife, she's a mom, she's a worker. She worked outside the home, so she provides income for her family. When she needed that substance abuse treatment, she had to go away for a bit. It meant that, her husband had increased duties, that her children had increased burdens, that, they didn't have that income coming into the family. But she knew very, very wisely that if she didn't do that, that she was not going to be alive for them, and it was going to be even worse on them. We have no problem with going back to grandma's wisdom: an ounce of prevention is worth a pound of cure. But there are costs that are involved, and we have to give people grace about those costs. And a support system is called a support system because when you support something, it takes work. So they're not easy solutions. It's not, there are consequences for self-care, and there are challenges to self-care. But if we don't do it, the end result is going to be so much worse.
Do you think this is one of the challenges of we hear a lot of stuff, the TikTok generation, the social media generation. I'm not picking on young people because I believe that we all fall into it. We just blame young people for it, even though I see all y'all on Facebook, especially when
all
the
of
people are
y'all, from my
complaining
perspective, you are one.
Yeah, absolutely. But it is fascinating to me that we say the TikTok generation, the Facebook generation, as if all of us aren't on social media. I see 60-year-olds on social media complaining about kids on social media. I'm like, you have become one. So so I want to be very, very clear. In our society, we like small tidbits of information. We like the 30-second videos. We like the 20-second videos. We like this 10-second videos. Do you think that this is preventing people from understanding that there's way more to you can't pour from an empty cup, self-care is advocacy, and take care of yourself? Those are the messages that get out there on social media, but there's so much more to that. Do you think people are misunderstanding what self-care actually is, and that people genuinely are starting to believe that self-care is, hey, I got a cup of coffee this morning, when that's not what we mean when we say self-care? And has that changed in 2021?
Some people are finding community through social media, and there's a lot of mental health information on TikTok, for example. So instead of everything coming from organizations like NAMI or from universities or government-funded health departments or whatever, you have independent people sharing their information, which can be good and it cannot be good. But there's a lot more people talking about mental health and addiction and getting help and those things. One thing that's disturbed me, though, is I read about influencers and suicide at a young age, and I don't know what to make of that. Whenever somebody's in the public eye and they're young and they die, you wonder if it's an overdose or suicide. So but there's more out there, and that's good when people are sharing positive things and taking care of yourself and supporting each other and body positivity and acceptance and things like that. But we've got the negative bullying piece too, which I don't see what the high school kids see, and what I get, comes from the media. But I see some stories of some really unpleasant things on social media where people are not being kind to each other. So it's kind of like the fire and the printing press. It's a mixed bag with positive and negative, in my opinion.
I don't 20-second TikToks, brief Instagram reels. I don't buy it, Gabe. Caveat emptor and Carpe Diem were around way, way, way before TikTok. The shortness, the brevity of it has nothing to do with it. What has to do with it is that our the relevance of it, the things surrounding it, the way that we the way that we look at work-life balance, the way that we, for years, especially a few years ago, we remember. I remember watching my dad just throw his life into his work, and he didn't have other supportive friends around him. He did not. He didn't engage in fun hobbies. He didn't. A group of friends and I, we started having conversations back in college about the fact that watching our dads, and they had acquaintances, they had business friends, but they didn't have anybody they picked up the phone and called and spoke to when they needed to talk something out. And we said, we're not going to do that. And we're still friends to this day. And we still get together on a regular basis, and we try to be there to support each other. I think that, but what I'm trying to say is that, all around us, what we're being told defines success and a healthy life has shifted so radically and is so imbalanced. And I think, this new generation is starting to get some of that stuff right. Starting, I love, even when you're looking at TikTok and reels, that you see so many people out in nature and they're doing things active and physical. And, for my generation, a lot of us don't do that. And, we've got to make some changes in those areas.
One of the things that I apologize. One of the things that has been big in 2021, now it started in 2020, so this is a bit of a straddling 2 years, was utilizing the internet for mental health support. And I don't just mean TikToks and social media, but as Jeff alluded to, programs like this. NAMI Tennessee Live at Home was started because we could not meet in person. I know that family to family classes and NAMI Basics are meeting over Zoom, something that never happened before. Telehealth. Now, full disclosure, a lot of this did start up in 2020, but it has really continued all the way through 2021 and has become not only perfected and prevalent, but it's just starting to become commonplace. I've actually heard people say, well, I'm taking X, and I decided to do it on Zoom, even though it is now offered hybrid. Or both. People have just opted to do it online. Also, in the case of, just to bring this a little closer to NAMI Tennessee, NAMI Tennessee is headquartered. NAMI Tennessee, the state organization. This organization is headquartered in Nashville. You've been able to provide services all across the state, whereas, of course, previously, if somebody wanted to take a family to family class taught by Roger and his lovely wife, they would have to end up in Nashville. Now you've done it on Zoom, which has really opened it up. Again, it did start in 2020, but it has really continued and become widely accepted in 2021. What are your thoughts on where we are with that and a look to the future? Is online support groups, classes, and things like that here to stay? Or as COVID fades into the rear view, are we going to go back to in person and forget about being able to do support groups online? You're thinking about it.
No, I'm waiting. I want to see if Jeff had anything to
Yeah,
say.
you go ahead,
I'll
Roger,
jump in
because
on
this
this
is where
one.
your
You know,
focus.
I've jokingly said for quite some time now that the Zoom giveth and the Zoom taketh away. It's really, you know, back to that Libra thing. Every coin has two sides, and it's given us so much and it's taken so much away. We miss that in person interaction. Um, all the stuff that's out there on, you know, in NAMI classes, family to family, there's nothing in family to family that you can't find online somewhere. The reason people want to participate in a family to family class is because you're hearing it from people who have lived it and experienced it, and they still have hope that they can give you that things can get better and be better than they are. And they can tell you skills that they've learned and other things along the way. And that is that value of being in a support group or being in a class and participating together in something. Um, you know, one of the fabulous things, I still love this, one of our early classes that we had when we swapped over to Zoom was with a family where there were three different components of the family um, who lived in three different areas. Um, they all lived about in a triangle about 9 hours apart from each other, but they were all able to be in a class together for the benefit of the person they care about with a mental health condition. And they have that support system was already in place. We gave that support system some new tools and some new skills to be able to continue and boost their support and new hope that they could work together to make things better for everybody involved. That's one of the incredible things about it. Now, the hard part about it, and this past weekend, I was engaged in 14 hours of Zoom training. And the reality is the brain can only hold as much as the butt can stand, and it's challenging to do that for a length of time.
That I I am seldom speechless, Roger, but the brain can only hold as much as the butt can stand. That may be the takeaway of 2020. I'm sorry, for 2021 for Gabe Howard. Jeff, your thoughts on
Well,
online support groups and things like that?
yeah, my focus here on this question is with NAMI Tennessee specifically, and the bulk of our classes and support groups is done by volunteers, and we are so fortunate to have really tremendously motivated volunteers who have had some challenges and they want to help other people, and that helps them, and that works really well. But we're not in every county. There's 95 counties in Tennessee, and we're in about 20 of them. So having Zoom allows people wherever they are to be able to participate. However, the in-person right now with the technology today does a better job at building community and connection. There's just something with over Zoom where I don't feel like Gabe. I think of you as a friend, but when I see you, it's not the same as when we're together. So right now we need both, but I do hope that one day that Meta or AR something where we will actually feel like we're in the room with people instead of looking at a screen will be better, and that we're in a hybrid stage now, but we need the person to person. So the online, it's better than not having online. And if we had COVID 20 years ago, I think our mental health would be a lot worse because we do have some ability to connect. So it's a mixed bag, and I would expect that NAMI in Tennessee and across the country we'll have in person and Zoom, and not just one size fits all.
That was so for me, I very much miss in person because I am a social person, and I understand that I am sort of answering that question from my vantage point, which I do like people, I like extroversion, or I am an extrovert, etc. For me, the big thing that is missed is it's identical almost getting the information, right? But here's what's missed. I think of all of the conferences or trainings that I attended where I'm going to pick on Roger for a moment. Roger delivered all of the information. Now, the information was fine. Roger did a good job on the eval. He got all tens. And Roger walks off the stage, and I'm now sitting at my table, and I can't just click off, right? Because I'm still sitting in the conference room or the training center. And I look over at Jeff and I say, Roger's great, but I didn't understand why he kept referencing this support system thing. And Jeff says to me, I was curious about that too. Do you think he meant X? And then somebody overhears us and walks over and says, I think, and all four of us start talking, and we're talking because we can't just click off and get back to our regular lives, right? And all of a sudden we have this really robust conversation about what we just learned, often referred to as hallway conversations, dinner table conversations, lunchroom conversations, water cooler talk. All of those things have a tremendous amount of value. That said, especially in rural areas, there are so many people that just can't get to these. Or, as you said, Roger, there is a cost to these trainings, getting self-care. Some people barely have the hour and a half for the class, let alone the 2 hours to prepare for the class, depending on where they live, how much travel time, etc. So for me, I sincerely hope that a hybrid does take place to take into account everybody. But for me, I hope we get back together as soon as possible because sincerely, I miss you. I miss all of you so much.
It's kind of like internet dating. There's really no such thing as internet dating. There are internet dating apps. You can meet somebody on the internet. You can get to know somebody on the internet. But unless you get together, it's not nearly as much fun.
It's fantastic. It sort of reminds me of a quote that I heard that said, "Speeding never hurt anybody, stopping did." And it's one of those philosophical perspective things, right? Uh, you're right. There is no internet dating. There's internet meeting, right? You meet online. And full disclosure, I met my wife online, and yeah, we filled out the little profiles. We thought we had some, cute quips, some cute jokes, some stuff in common, but yeah, if I would have met her that day and there would have been flat chemistry, her voice annoyed me, I was too loud for her, whatever, it would have been a one date and I wish you well, good luck, no matter how we felt about our profiles matching up. I think I really like that analogy, and I think there's a lot of sentiment. Now, I know we're running short on time, but one of the things that they always talk about in the hybrid method of online versus offline is simply offering both, allowing some people to be online and some people to be offline. What about a true hybrid method where maybe the first class is in person, and then you do, I'm making this up literally as I go along, the first class is in person, then you do 4 online, and the last 2 classes are live. I don't know that anybody's considered a hybrid method along those lines before. What are your thoughts on that? Do you think it's a good idea, or are you just not sure?
Okay, NAMI's doing some of that with teacher training, where you watch some videos and then you have classroom to eliminate the sitting too long problem. I want to talk about one other thing before we run out of time, though, Gabe. And your candy canes were reminding me, I think of sugar as a drug sometimes because of craving. And I want to talk about psychedelics before we go, because psychedelics have been a quiet part of the news about mental health in the last year. And it's a little bit, I'm a little bit, what's the word, perplexed. Because we don't want to tell people to just go out and use drugs and get high, and that's going to make your mental health all better. But there continues to be research and evidence and promise about some of these medications that were discovered in the 60s and afterwards, and then the government said, no, these are illegal, and that they may have some therapeutic benefits. And there's so much suffering going on. And even though we have treatment and meds and therapies and peer support, not everybody gets better at the same speed. And so I hope we have new treatments. And I think there's a lot of promise. And I hope there's continued research and finding out what's safe and effective and not just people experimenting at home. So it makes, I'm perplexed because to bring it up, I'm not wanting to say, hey, go and try this stuff, but I do support research and education on ways to help people.
It's been a fascinating trend in realistically probably the last 30 years, but we've really started to see this in the last 10 years where certain substances, you pick them up and you're like, hey, look, I found this and it does X. Oh, well, let's research that and find out if that's good. And then somebody else walks along and says, hey, I found this. That's bad. Put it down. Well, but it kind of does the similar things to that. No, this is good. This is bad. And we can give a million examples of this. Alcohol good, marijuana bad, cigarettes good, just on and on and on. But bringing this to a mental health space, the reality is they're called mind-altering drugs. Now, bear with me for a moment before anybody sends me hate mail. If you have severe and persistent mental illness, all of the drugs that we're put on are designed to alter our minds. That's literally their function, and it's fascinating to me that we've decided that this is good and this is bad. Now, I'm in the same camp with you, Jeff. Don't run out to your street corner and buy something because one, you don't know what you're buying. There's no FDA for homemade products. So just there's a million stories of people having bad outcomes, not because of the psychedelic or the components itself, but the things that were added to extend profit or mismanaged, mismade, or mishandled. But we've seen a lot of research, again, in probably the last 30 years, but really started hearing about it in the last decade. Look at ketamine, for example. This was literally a party drug, and now it's on the front lines of treatment-resistant depression, showing fantastic results, and people who have lived with treatment resistant depression literally their entire lives are starting to get incredible relief. I don't know what that means for psychedelics. I just know that it is interesting that this group of mind altering drugs is good, and this group of mind altering drugs we can't even investigate, research, or look into because we decided, I don't know, 70 years ago that it was bad.
Well, I think this is the change that in 2021, there's serious people looking at it from a research point of view, not just individual people like Timothy Leary, being a crusader, but there's some science coming into it. And there appears to be some promise, but we need to learn more.
It's really important. Oh, I'm sorry, Roger.
I'm just going to say I'm all for expanding the toolbox. Philip said screwdriver is not going to work for every construction job, and the more tools that trained professionals have available to them, the better off we all are. Yeah.
I could not agree with that more. It's important. I know we're running out of time, but it's important to point out that one of the things that many advocates are asking for is not just the immediate release of all illegal drugs to use however you want. We're asking to be able to research them. One of the problems with these substances being illegal is it means that researchers cannot research them because, after all, you can't commit an illegal act in the name of science. It's important to understand that no matter what your intentions are, you can't commit crimes and call it research. So because these substances have been illegal, researchers who think, there might be an element of one of these things that could be extraordinarily beneficial for all kinds of illnesses, they can't even investigate it. Again, that is changing. Research is changing, or laws are shifting, things are shifting, and I think that that's fantastic. But consider that 50 years ago, if you were an intrepid doctor that thought that mushrooms, for example, psychedelics, could help somebody with cancer, tough. You are not allowed to possess those things, research them, use them on people, study them. You would be arrested for, all kinds of crimes. So that's really kind of a shame, right? I mean, who knows? One of these illegal substances could literally be the cure, not just for mental health issues, but for physical health issues as well. It's stunning. Remember, we cured, I believe it was smallpox with the udders of cows. I mean, it's fascinating. Who knew?
We want it to be risk-free though, and that's a part of the challenge. Is aspirin is great unless you're the person that's allergic to aspirin. Marijuana can be beneficial to some people unless you're one of the people that marijuana triggers something much more significant, like schizophrenia. Some people have genetic backgrounds that where marijuana can act as a trigger for much more serious conditions.
And research will help us understand.
Research helps us understand that.
Those risks. Yeah. Listen, I take all kinds of medications, and I read the back of those bottles like, do not take if you've had the following things. I'm like, I've got some of them. I didn't have them at 25, but I'm starting to get close. This hour has flown by. We're actually over our hour, so we have to hop on out of here. Roger, Jeff, as always, phenomenal 2021. Please keep doing the incredible work that you are doing.
Gabe,
at NAMI.
two last words, if I could.
2 last words. I'll let you, because you're my boss.
Some young people thinking about careers, encourage them to think about mental health. We need more mental health workers. And 2, I'm very proud of what NAMI Tennessee did in 2021. And if you go to our webpage, namitn.org, that's namitn.org, you can see our year in review there. And I hope you take the time to do it. And thank you for the year, Gabe.
Oh, you're very welcome. And listen, namitn.org is also where you can sign up for NAMI Tennessee's email list. Look at that. I brought it back around. Thank you, everybody. Have a very, very happy holiday season. We are super excited to now be on YouTube. NAMI Tennessee has a YouTube page, and we're broadcasting live. If you're watching it on YouTube right now, you're probably not a bit surprised. Bye, everybody, and we will see you next week. Big wins,
Happy New
everyone.
Year.